This is the Emergency Medical Minute, sponsored by Health One.
But instead, I was going to talk about vitamin C in sepsis. So, has anybody heard any of kind of the little what's that?
We follow some with vitamin C or something?
So that is a question. So there's been trials over the last couple of years suggesting that vitamin C might be helpful in septic, especially the sick septic shock patients. I don't know when it all started, but about 3 years ago, there was a study that was not a randomized trial. It was a before and after trial, and they compared mortality in septic shock patients before they started the intervention and then after the intervention. And the intervention was a cocktail of vitamin C, thiamine, and hydrocortisone. And this study showed that before they started this, mortality from septic shock was 44%, and after it was like 8%. Incredible results. Some might say too good to be true. So since then, there's been a couple of trials, and in the past, month to 2 months, a couple of actual good randomized trials have come out looking at this. And the most recent one is called the Vitamins trial, kind of a nice title. And it was a randomized trial. It still wasn't blinded, but it was randomized for patients to either get the same thing, hydrocortisone, vitamin C, and thiamine, and to see whether it helped. And in this trial, there was no benefit at all to this therapy. So it's still a very controversial topic in the sepsis world. There's some people that believe very strongly in vitamin C, that it improves organ function and is a lifesaver, but there's now studies that show that it doesn't help. There's probably more randomized trials coming out. We have not adopted this here at our hospital. Most people have not adopted it because there hasn't been good data for it, and it's hard to change practice based on a couple of studies. But it's something we might keep hearing about. Patients might even ask about it, like if their family members here with septic shock and they say, why aren't you giving them vitamin C? And right now there is not good data to support it. So any questions? Thank you, guys.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.